Do you have dental insurance at all?
No.
What do you need today?
Well, I did have my bone tooth for like 3 years ago.
I'm here today to get a tooth jerked out. So, when what the deal is, I'm on Medicare. Well, Medicare doesn't have any dental, so I'm looking at like $50 here and $150 anywhere else.
Do they give the gas?
We can. It's an extra charge.
I know a guy that died from the infection. It went to his brain just from the tooth, and yeah, it's pretty bad. That's pretty bad. It's been a lot of pain and everything like that, but I'll get it out and that'll be over with. But this is a wonderful program they've got. They help a lot of people.
Redbird Mission is located in the corner of 3 counties in southeast Kentucky. It would be Clay County, Bell County, and Leslie County. And it is located in a spot where there really is no town around here. Redbird Mission started in 1921. So it started out as a settlement school here in eastern Kentucky. And eventually we started adding some of the other services, some of the other outreach services. We're an underserved area. And so the access to dental care, and particularly specialty dental care too, is few and far between. So there was a real understanding, once again being driven by the needs of the community, that we needed to have dental care here. The Redbird Dental Clinic opened, I believe it was in 1976. We've had multiple dentists through here, very dedicated people who understood that healthcare was not just coming in and getting your blood pressure taken or taking care of infections or illnesses. The clinic has basically served pediatric through adults. We struggle at times because sometimes there's payment for services and sometimes they're not. We look for donations, we look for opportunities to do grant writing. We've had a couple dentists at a time. Other times we've been without dentists, and we've prayerfully waited until the right person came along, as within Dr. Collins.
About every 3 months you just did the cleaning.
I'm Dr. Bill Collins. I'm the dentist currently here. I've been asked to become the dental director for Redbird. There's a lot of need here, and they had over 300 patients on a waiting list. It's not just routine dental treatment. It's not 6 months cleanings. There's a lot of kids here that we need to get into a preventive system. There's a lot of adults with a lot of bad teeth that needs to come out, and we're talking full mouth extractions. The Medicaid expansion really put a lot more people under the umbrella, and we've been able to help a lot more.
We do have a lot of people in this area that are really big soda drinkers. So with that, we see a lot of the same cases with a lot of decay. At least 60% of our patients are denture patients or need dentures. A lot of cases they can't afford them. We have a lot of people who have transportation issues. Either they can't afford the dental visit or they can't afford to get here.
We have people who have not been able to afford to get dental care, and we do have a sliding fee scale here, and we do serve people here that don't have insurance. And it's just by the gracious gifts that we get from donors in order to be able to do this. We link this to our economic opportunities too, of getting them dentures or getting the teeth fixed in a way that they feel better about themselves. When you're going to send people out for job interviews, you can't send them out not being able to speak clearly because they don't have teeth in their mouth, or that they're in pain because of this, or they're having chronic infections. Our outreach program works really closely with the dental clinic. So when people come in to the dental clinic, we look for needs that they may have, housing needs that they may have, food needs that they may have, some basic kinds of needs that we can link up, and we can, because we're right next door to each other, we can get them screened and get them connected to resources. Likewise, the other way around. So we get people coming into our outreach office. If they have some needs for dental care, we can link them up also with the dental clinic.
Our family has been coming over here for years, and the things I have seen over the years that they help with, a dentist is your most important thing about your health. If you can't eat, you can't feed your body, and your body will go to waste. But this is really important for the whole community that, keep this going. I don't see how these people could live without Redbird Mission, because it's a really nice place.
This program is part of Inside Oral Health Care in Kentucky, an ongoing KET initiative funded in part by the Foundation for a Healthy Kentucky.